Hello, I'm Dr. Adam Lockett, and in this video I would like to go over the medications that are offered at the dispensaries and talk about dosing as well as routes of administration. Again, I'm board certified in physical medicine and rehabilitation and pain medicine and have been practicing in the Twin Cities for the last 10 years. If you go to our tab on TimeWise Medical under Medical Marijuana and scroll down to the manufacturing sites, I'd like to start by talking about the site for the manufacturer's products of Leafline Labs. If you click on the tab Our Medicine, there's a very nice, very simple and simplified explanation of the medicines and the different categories. Essentially, we have three options. We have, on the left, a high THC and low CBD oil. We have a equal part THC and CBD oil. And we have a high CBD and low THC oil. These are oil extractions from the whole plant and do not contain any additives. This is different than, say, the oils found for nicotine or tobacco replacement, which use propylene glycol and vegetable glycerin. The oils from our manufacturers are completely natural. So in looking at these three categories, they've simplified things for us very much, and I think this is very helpful. If we look on the high THC side, these names do not represent plant strains but have more to do with just product names, but I think they're very appropriate. And when we look at a high THC product, we think of it as a stimulant. When people hear that there's lots of THC, they often think, well, am I going to get a high or a buzz from this? And the answer is no. In the concentrations that are being produced, even in patients who have never tried marijuana in the past in any way, find that they do not feel any mental clouding or ill effects from this and continue to function normally throughout their day. If one is tolerating high doses or any doses of pain medications and has been on those for a period of time, one understands that one becomes tolerant of these medications and the mental side effects go away. But in the case of cannabis oil at these concentrations, which are designed for medical use, this does not happen. And so none of the patients that I have placed on the registry have complained when vaporizing this oil that it is at all mentally confusing or causing them any sort of high. So THC can be thought of as a stimulant. It stimulates the part of our brain called the periaqueductal gray matter, which causes analgesia or pain relief. And this is why, as a stimulant, it is very helpful. It also stimulates the part of our brain that controls appetite, and by stimulating that, it also relieves nausea and often vomiting. And so all of these are symptom reliefs that are found with this medicine here on the left, which is this tangerine. Now switching on to the other side, we look at the high CBD on the right-hand side, and that is a very useful medicine for treating or relaxing different parts of the body. So for epileptic fits or seizures, for all types of inflammatory conditions and rheumatic conditions, for autoimmune conditions, this is the product and the medicine that we're looking at. The interest in CBD has grown greatly because it may also have anti-tumorigenic or anti-cancer properties. We don't know that for certain because it hasn't been studied to the fullest, but we certainly believe that that may be a property of CBD. So in summary, for pain relief, we're certainly going to be looking at the high THC products, and for anti-inflammatory, autoimmune, and rheumatic conditions, we will be looking at the CBD products as well as for anti-epileptic conditions. And then the middle category is a balance of the two. So let's then just briefly switch over to Minnesota Medical Solutions, which is the other manufacturer of our medicines. So in looking at Minnesota Medical Solutions site about these products, we can go to their product tab at the top and click on which products are right for me. If we scroll down to their product line, there is a very nice diagram here. And again, if you just focus on the top, there are three main categories: THC dominant, balanced, and CBD dominant. But if you look at the THC dominant strains, there is 4 options within THC dominant. Why do we see that? We see that because as we use this medicine, we note that there is no mental clouding and no side effects, and we want more of the THC to control symptoms. In addition, the oil that is being produced is odorless, and the terpenes or odor-producing chemicals characteristic of fresh cannabis are removed. However, one of the products that is being produced at Minnesota Medical Solutions has started adding a bit of this back in for flavor primarily. Again, this is for vaporizing in an oil. So, at this point, I'd like to talk about routes of administration. And to do that, I'll scroll down a bit further here. If we look at the options of oils, or oils for vaporization, or oils in capsules, what we see are options for administration, but the important thing is, what are we trying to achieve in terms of administration and delivery? For replacing pain medicines, which is one of our main goals, patients who are taking high or doses of opiates every day and are looking to replace these with vaporized cannabis oil will find them to be almost equivalent in terms of onset and in terms of action and in terms of length of administration and time of administration. In other words, by vaporizing an oil, we have an onset with a good puff with about 10 to 15 minutes to feel the effect. One can note their pain score on a piece of paper on 0 to 10, and 10 minutes later, write down that score again, and the effect will be noted, and the score will likely be lower. If one does that again, the dose will be again administered through a puff, and it will be within 10 minutes, you'll note the effect again. One thing to note about vaporization is that it's very safe. It is not equivalent to smoking in any fashion. It is more equivalent to aerosolization of medicine like that of which we do for asthma nebulizers and other types of aerosolized medication. As I said before, there are no additives to this type of vaporized oil, and so it is extremely safe for the lungs and actually likely very much helpful and protective for the lungs. So, going back to using this for pain, if we look at a THC dominant product and we want to use that to replace a pain medicine, we would vaporize the medicine instead of taking it in a tablet or a capsule. And why is that? Well, if we take cannabis oil in a capsule, the administration, as it notes here, takes about an hour, and we shouldn't take anything else for at least 3 hours after that. That's a very long time to wait. And for most patients, that's not going to work for pain control. However, if you're trying to place lots of CBD into your system to help with anti-inflammatory, rheumatic, autoimmune conditions, certainly taking a capsule, but not necessarily waiting for an effect immediately, more looking for general health and looking to improve one's condition overall, then the capsules become very much appropriate. Other types of administration, such as the oils in a tincture, or in a solution of spray are also helpful, but primarily reserved for patients who cannot swallow or cannot take a vaporization, such as a child who has an epileptic seizure. The sprays are helpful for that. However, the sprays and anything delivered sublingually is often swallowed and not very effective overall. So again, for pain control, for looking to replace pain medicines and other medicines such as anti-epileptic medicines used for pain like gabapentin or pregabalin, we would want to use the vaporization method. And in a separate video, I will go over vaporization in detail. In general, though, one starts low, and goes slow. Thank you for your attention.